Support comes from the Rosa Parks Museum on Troy University's Montgomery campus. Located on the spot of Mrs. Parks' historic 1955 arrest and featuring exhibits that chronicle the history of the Montgomery bus boycott. More information at troy.edu/Rosa Parks.
If it's Monday at 12:40, then it must be time for TPR Podcast Presents. I'm Austin Toy. Every week, we bring you selections from one of Troy Public Radio's 13 locally produced podcasts. Today's subject is wound care. Not the sort of wound you get when your crush doesn't text you back, or even the kind of minor cut you might get from being careless with a kitchen knife. We're talking about serious wounds that require serious treatment. Shannon Godsave is a wound care and hyperbaric medicine nurse practitioner. He's actually Alabama's first nurse practitioner certified to supervise hyperbaric oxygen therapy. He spoke to Kate Nesbitt and Brooke Mosley on the Rounds podcast about how he heals wounds with oxygen.
Hyperbarics is concentrated oxygen. It's 100% oxygen that you breathe while you're in the chamber. But the difference in breathing that and just oxygen out of a bottle through a mask is the fact that it's pressurized. What it does is when you breathe in 100% oxygen, let's say you're in the hospital and you're having shortness of breath and they put you on a mask and they give you 100% oxygen on a mask. Okay, that increases your blood oxygen level to a certain point. Whenever you go into a hyperbaric chamber, it changes the gas laws with pressure, and it forces that 100% oxygen even more concentrated into the bloodstream because of the pressure. It's one of the gas laws called Henry's Law. It's a pressure-induced 100% oxygen forces more 100% oxygen into the bloodstream, which then ultimately makes it to the tissue or to the distal parts of bone, like the toes or fingers, that do not get a lot of blood feed anyway. Those bones do not get a lot of blood feed. So whenever you increase that oxygen and that pressure, bacteria hate oxygen. Whenever you oxygenize a bacteria, the bacteria cannot thrive. So that oxygen helps kill the bacteria. Well, in conjunction with the hyperbarics, we usually have patients on antibiotics that kill the bacteria that are eating bone or tissue. And those two things in conjunction help stop tissue loss, stop bone death, and ultimately save either toes, feet, legs, hands, whatever is affected by bacteria and the flesh death.
Oh yeah, I mean that is a lot more than I thought was happening.
It's pretty intense as far as using those two things in conjunction. You know, IV antibiotics, we treat infection with it, but whenever you start talking feet that have osteomyelitis or toes and you have bone destruction from a bacteria in there, you're just giving IV antibiotics, you're kind of just sprinkling a little bit of sand on top of a big beach. You have to dig in there and get to it to stop the erosion of the bone. And to do that, the high pressure oxygen, as in conjunction with the IV antibiotics, usually does it. And then you save the person's, affected limb or toe or however, whatever is affected.
What are some of the different wounds that you kind of deal with?
We have a variety we deal with. Anything, any wound. It can be a laceration flap. It can be a diabetic foot ulcer. It can be arterial or originated ulcers on the leg, venous stasis ulcers, burns of any stage, all the way to full thickness burns. We deal with a lot of those. If you have an abnormality on the skin, it's a wound, we deal with it.
So have you had any rewarding experiences while doing this? Anything that's continued to kind of interest you within wound care?
Absolutely. I mean, we see wounds that we end up healing out I've got one man that went to the hospital and was admitted and to have surgical debridement of his foot because of the wound. And then I was consulted, and I went over and seen his foot. It was the weekend I was consulted, went and seen his foot Monday morning, and worked with the surgeon. Had to have another debridement, and then we brought him over quickly that early next week and got him into the hyperbaric chamber because he had necrotizing fasciitis of the foot. And so with I don't know how many dives, these 6 weeks of dives later and a lot of surgical debridement done within the clinic setting, we've about got him healed where he saved his foot. So that happens routinely where we're able to make a difference. But a lot of it is, I'll be honest, is adherence to what we ask to be done, to compliance, patient compliance, because we make recommendations and it's up to patients to follow what we ask, and there are some that just don't, whether one reason or the other, and then there are many that do, and we have a great outcome.
Is there anything that you wish that students were learning about hyperbaric medicine while they're going through all these different, classes and stuff? Is there anything that they kind of, maybe not people who are necessarily interested, but things that they should learn? Because I know that earlier we've talked about you being asked to consult on stuff, and there's a lot of, multidiscipline and specialties that are kind of working together, especially for wounds. Is there anything that you would want students to kind of know, just education-wise, before they get into the field?
Multidiscipline-wise, we work hand in hand with surgeons, orthopedic surgeons, vascular surgeons, dermatology, family practitioners, or to internal medicine. When you start talking about wounds and the origin of wounds, you have to work with those other specialties to, provide what's needed for that patient to be able to heal. An example being a diabetic foot ulcer. What's a patient's hemoglobin A1C? What's their blood glucose been running? Do they have a family care doctor? Have they been going to the doctor? Do they take their diabetes medicine? Do they have proper offloading in their feet? So you have to start talking about shoe inserts and sending them to those type of people. So when you get into wound care, you have many different people that you have to interact with, different providers, and be able to know when to use them and consult them and bring them in on patient care.
Yeah, so you mentioned going through essentially a nursing curriculum 3 separate times, from your LPN to your BSN and then through your master's program. Do you have any advice for those nursing students who are currently struggling to learn all those medications in pharm, or who just are wore out and ready for it to be over with? Do you have any advice for them?
Stick with it, because in the end you'll reap the rewards of what you have put all your hard work into. Just stick with it. There was many times that I was tired. I was working full time, going to school full time, family full time, and it's tiresome. There's hours where you have to sit and study, read, do clinicals, and you're tired and exhausted, but do it now, stick with it, and you'll reap those rewards.
You can hear the full conversation with Shannon Godsave on the Rounds podcast, on Spotify, or at today.troy.edu/podcasts. I'm Austin Toy, and this is TPR Podcast Presents on listener-supported Troy Public Radio.